And on the phone with me, also, well, no, actually on supertalk.fm/watch. It is the one and only, the doctor of the program, Dr. Randy Easterling. Good morning, sir. How are you?
Good morning, Mr. Gallo. How are you? Trust you had a Merry Christmas and a Happy New Year.
We had a very Merry Christmas. We overate and happy,
You
hopefully.
do that every day.
No, I don't do it every day. I just do it when I'm not doing it every day. So I don't want to get into that.
Oh, what would you do without Perez there? I mean...
Well, my stress level would be...
Don't start.
Where's the calculator?
Don't start.
No, it won't be.
We'll get you some medical marijuana.
Well, that's another
Hey, that's an idea.
In other words, that stress could be relieved with a little medical marijuana.
Do we know any doctors?
I do have this pain right here. Let me ask you first of all, what's your thoughts on? We have 1,365 is the what we have today. 1,365, the latest reports of new cases. 235 of those are in the long-term care facilities. We had 41 additional deaths. We've had 206,388 total. We've had 4,606 deaths in the state of Mississippi. You heard the president-elect said we are doomed. The worst is yet to come. From your perspective, what's your thoughts?
Well, I think there's certainly a lot of concern over the next several weeks. We had Christmas 3 days ago. We've got New Year's Eve and New Year's Day coming up in another 3 to 4 days. So we're going to hold our breath, and hopefully people will do what we've recommended that they do, which is have no social gatherings, stay with the nuclear family, wear a mask, wash your hands, social distancing. Those are proven things that work. So if we can get past the next couple of weeks, hopefully we'll see a significant downturn, especially with the vaccine. I got vaccinated a week ago today for my first shot, so I have 2 weeks to go till I get the second shot.
Yeah. Any side effects from that?
No. Actually, I accused the nurse when she gave me the shot of not actually giving me the shot because I didn't feel a thing. And I've had a little arm soreness. But certainly nothing more than you would get with tetanus or a flu shot or whatever.
So that's what I said. It's commensurate to what you would have with a flu shot, a little feeling of warmth in the arm. Basically, that's it.
Yeah, my arm got a little sore a couple of days later, but I took a Motrin and I'm fine.
What is next? The next one is, of course, we are, I would hope most of the people in nursing homes are going to be able to get this. What's the status of that? Do you know?
Well, I'm not sure. I think a lot of that's going to be done through the chain pharmacy, CVS, and so forth. But those should be starting this week, I would think, if we have the doses in the state. And I actually have a conference call tomorrow that will be dealing with that issue. So I'm not exactly sure where we are on those doses.
One thing I've never understood here is when we're given the cases from the health department, like we had 1,365, but they did note all the time when they're reporting 235 of those 1,365 cases were in LTC's long-term care facilities. Why wouldn't they give us also the additional deaths are 41? Why wouldn't we get how many of those deaths emanated from people who were in long-term care facilities?
Well, I'm not sure about that. You'd have to ask Dr. Dobbs. I think he has consistently just reported the bulk of deaths. I'm sure you could drill down on that and find that out. Now, whether or not that's part of their policy to let that out or not, I don't know. I know he's been very stringent on not giving specific nursing homes or long-term care facilities, and I can understand that. But as far as a whole, that information is probably available.
You've been not an advocate but an opponent of hydrochloroquine. What is it?
Hydroxychloroquine.
Hydroxychloroquine. There we go. Your thoughts is still the same as far as that's concerned?
Well, I haven't opposed it. I've just simply said what the scientific community has said, that there's no scientific evidence that it works. Yeah. There are anecdotal evidence that it works, but there's no scientific evidence. So that's my position, which I think most physicians take that position.
By the way, the other shot that's coming out, it's nearing completion or as far as distribution. That's the Moderna But that's also
Yes.
2 shots, is it not?
Yeah, but I think the difference is on the Pfizer, which I got, you get the first shot. And by the way, after 10 days from the first shot, you get close to the same immunity you get from having COVID. Then you get the second shot 21 days later from the first shot. With Moderna, I think it's 28 days, so it's an extra week. As I understand.
There is a third shot coming, and do you have any information on that one?
I think that's the AstraZeneca
That's
product,
right,
and
yeah.
that's the one. If I'm not mistaken, you don't have to keep it super cold temperatures.
Do you
I
have
think
to keep
that can
Moderna?
just be put in a refrigerator. Yes,
Yeah, is
Moderna
Moderna
has
also
to be. Yes,
the same
as I
way?
understand it. Yeah, and that's posed a real problem with distribution because you have to pack this in dry ice, and nationally we have a shortage of dry ice. You know.
Why is that?
Well, because the people that make dry ice, it comes from CO2, weren't geared up for this. They don't have the manpower or the facilities to make huge amounts of dry ice. And then if you ask them to gear up and buy additional equipment, hire additional people, hopefully this thing's going to be pretty much over in 6 months. Then what do they do with all the equipment that they've invested hundreds of millions of dollars in? So it becomes a business issue.
Well, the other part of that, too, is hopefully we'll see some of the death counts or the cases decrease in these long-term care facilities as we get more and more people there. I would imagine that the first responders and the healthcare workers have already gotten it, so that's going to help out one way or the other.
Yeah, as I understand it, all of our medical staff in Vicksburg has been vaccinated that wanted it. We've also given it to frontline nurses and respiratory therapists, people working in the ER and the ICU, and appropriately so, and on the COVID floor. I'll be quite honest with you. We have had a problem, I think, statewide and nationwide with some measure, some percentage of nurses refusing to take it, which is very concerning to me because if anybody needs this vaccine, as much as physicians do, it's the nurses that are actually there holding the hands of these patients.
Yeah. Well, since you brought up medical marijuana, what's your thoughts on what the legislature should do or can do? We just talked to Sam Mims, and apparently there's been some chatter around it. I'll be honest with you, I don't think they know what to do with this because since it's in the state constitution, there's not much they can do.
Well, I agree with that. And by the way, I was not aware that Chairman Mims had COVID, and I certainly wish him good luck. He appears, I watched him on the computer, to be doing well, and he's been a great advocate for patient care in Mississippi, and so we wish him well. Just to comment on this time, Paul, and I don't mean to beat a dead horse, but I think it borderlines on criminal, if it's not criminal, that the Mississippi State Health Department, in the midst of this pandemic and all that they have to do on their plate, is now charged with starting pot shops around the state and regulating the medicinal use of marijuana. When we've got people, we've got so far 4,600 Mississippians have died from this virus, and now that's on their plate. And I don't think there's anything the legislature can do about it. I think the only hope out there is that the Supreme Court will side with Mayor Hawkins.
Well, I don't know. I've got it here, and I've read it over several times, and there's so many things. And not being a lawyer, I have to understand that the people who put this together have legal minds that are pretty good, and they know what they're talking about. But just as a layman, there's so many things in there that make me feel like a couple of things about it. That a small number of people in the state of Mississippi dangle candy before them. It could be, chocolate, but it's actually X-Lax. But with $600 million in money to make it sound good, they bought it. And there are so many holes in that it's just scary. And I would think somewhere in there the Supreme Court could look at it and say this thing is antiquated and it's got a lot of flaws. But it's always good seeing you, sir.
Good to see you. Have a happy New Year.
Care.
Please, everyone get vaccinated. Please stay with your core family. Do not go to parties for New Year's Eve or New Year's Day. Don't have 20 people in your house to watch football. Please, let's get through this.
You got it. Thank you, man. Appreciate it very much.